Today is June the 24th, 2012, and I'm standing on the steps of the Supreme Court building in Washington. Later this week, the Supreme Court will announce a decision on the Affordable Care Act. There is strong feelings on both sides of the Affordable Care Act, to be sure. The court justices have been measuring the government intrusion into the health care of the nation to see if the Constitution itself has been abridged. But whatever the majority decision, the status quo in health care is not acceptable. With our entitlements, we have a hybrid form of health care. Those are generally messy and inefficient, especially when you get the politicians involved in the administration of the plan. The Affordable Care Act adds about 30 million people, with about half of those coming by way of Medicaid. 3 points. 1, the Affordable Care Act comes with a mandate to buy insurance or to be taxed. Where does individual responsibility fit in? Does our freedoms extend to being negligent without a penalty from our government? This is a key question for the court. 2, the administration started out talking about cost containment, but that faded with the finished product. One reason for runaway cost is there is not adequate competition in the health services. In some states, one private insurance carrier has 80% of the business. The Republicans are making noise about cost and the fact that the Affordable Care Act does not include cost containment as they would wish it. But do we really think they could make the decisions necessary to establish competition? 3, one-time comprehensive health care reform, it was a mistake in my opinion. Health care reform should be instituted in an incremental fashion. Deal with one area at a time. For example, focus on the extraordinary and widespread fraud that permeates the system. Then move on. Each incremental reform should give insight into the next needed reform. Our healthcare system must be reformed, and reform cannot be written by those with a vested interest, such as the health insurance companies, the health providers, etc. Simply, the country cannot afford a plan that protects and expands the profits of insurance companies and the high incomes of healthcare providers and administrators.